Hey guys, what's up? My name is Moshe Levin and I'm a registered nurse in Israel. And today we're going to be talking about medications. But first, don't forget to like this video, subscribe to this channel, hit that notifications bell, and of course, comment any suggestions or any remarks that you might have on these videos. So today's topic, medications. What are medications? Medications are substances that are meant to make our patients either feel better or to heal our patients. Whether it's antibiotics, painkillers, or any other form of medications that are used, these medications are dangerous substances, especially when used improperly. Sometimes, even when used properly, these medications can cause very, very severe side effects and sometimes even harm our patients long term. It's very, very important for us to always keep in mind these side effects whenever deciding to put a patient on a specific medication, and also to always warn our patients and teach them about the side effects of all the medications so that they can keep track of it. And if something becomes unbearable or something becomes dangerous, they should let us know so that we can change their medication. So first and foremost, safety. It is always very important to make sure that the person who is preparing the medication is being safe and is keeping themselves safe from damage that the medication could cause them. If we are preparing a medication, we always have to make sure that firstly, we don't get stabbed by any of the needles that we're using in order to prepare the medication. That's very, very important. We should always take extra precautions and follow the rules so that we don't get stabbed by any of those needles, especially after they come in contact with dangerous medications that could be cytotoxic, meaning toxic for our cells and therefore destroy the cells of our skin and sometimes even tissues under the skin. It is also very, very important to make sure that we know the procedures to follow if there is a spill of a dangerous medication or if a dangerous medication gets on our skin, in our eyes, on our clothes, so on and so forth. There's always a list of MSDS for every single substance that is used in the hospital, and it's always good to know where it is and always good to keep up to date with the medications that are being prepared, medications that are commonly used, and how to deal with spills, so on and so forth. Of course, no less important is to make sure that our patients are safe. And the first and most important thing that we need to make sure is that we are giving the medication to the proper patient, to the right patient. In Israel, we have a system to try and prevent as many mistakes as possible. One of the main things that we do when giving a patient any form of treatment, especially medical treatment, is two-factor identification. When we come to give a patient medications, we are required to identify them based on a two-factor identification system, which is their full name and then one other factor that we have readily available to us in their file, whether it's their father's name, their identification number, or their date of birth. All these things are readily available in their file, and we can identify them quite easily based on those things. The next very, very important thing is to make sure that it's the correct medication. We sometimes have medications that look very, very similar or sound very, very similar, or might not even look or sound very similar, but they're from the same therapeutic group, the same group of medications, and we can think that, oh, possibly we can switch one for the other. And in some cases, yeah, it won't cause a lot of harm if we do switch from one medication to another in the same group. And sometimes even switching manufacturers can have very, very dire consequences on the patient if they take from a different manufacturer, because there are slight changes between manufacturers. It is also very, very important to make sure that when we're giving out the medication, we give the right dosage of the medication. This is also very, very important for pills, but pills are slightly easier and less complicating because generally pills, it's very, very straightforward. how much of a certain medication there is in that pill, and it's quite easy to tell if you can split a pill in half or if you can't split a pill in half. They generally have a line indicating whether they could or can't be split in half. But when it comes to IVs and different types of injections, it could become slightly more complicating, especially when working with different substances that have the same active component but at different concentrations. It could get complicating. It could become quite difficult to calculate, and therefore it is always suggested to use a calculator when calculating these things. Even if we are 100% sure that we're doing it right, always use a calculator to make sure and double check yourself that you're doing everything right. Another thing that we always need to make sure that we're doing correctly is the right timing. When a patient is getting medication once a day, if they get the medication an hour or two earlier or later, it's not the end of the world. It's not optimal, but it won't cause a lot of damage in most cases. Whereas if a patient is getting a medication 3 or 4 times a day, that change of an hour or two in administration of the medication could cause a lot more damage, because it could cause either higher levels of the medication in the blood to a level that could lead to overdose, or too high of an action of the medication, which would cause possible damage to the patient. Or it could mean that the patient is a too long amount of time without the proper therapeutic blood levels of that medication, which could also cause damage to the patient. And therefore, we should try to make sure that the patient gets their medication as close to the time set as possible. Last but not least, and not less important than anything else, is to make sure that we're giving the medication through the right route. If the patient gets a medication through IV and for some reason we can't get the IV at that minute, we shouldn't be giving the medication at a different route, whether it's intramuscular or even pills or anything like that, because different routes have different levels of absorption. And those levels of absorption are taken into consideration when recommending dosages. Yes, there are certain medications that are given at the same dose, whether it's IV or pills, but through IV, the absorption of the medication and the action of the medication will be slightly stronger than in a pill, because through the digestive system and through the metabolism of the medication, we do lose some of the effect. When giving IV, we lose a lot less of the effect because we don't have that passing through the intestinal system. It's very, very important to pay attention to all these things when preparing and giving out medication so that we prevent as many mistakes as possible.